back, listeners. Now with us is Dr. Gootzeit, is here to tell us about some exciting medical office specializing in physical medicine and rehabilitation. It is opening this afternoon. Doctor, could you tell us something about your medical office?
Well, it's going to be on 32nd Street and Roosevelt Avenue at 3130 Roosevelt Avenue. I'm working with John Porter. John Porter is a certified medical acupuncturist. He's also a rehab specialist. I'm working with Robert O'Connor, who's a psychologist, but he also does medical hypnotism. And we're working with a guy named Sonny Suskanov, and he's a chiropractor. And our concept is a little different than most offices. We're going to teach you how to get better. We don't want to take care of you for the rest of your life. We want you to understand your pain, and with your understanding, you will be able to affect how well you're doing and how quickly you get better. The key is the input of the patient. We are not going to be an average office where you just come and we give you a pill or we tell you you need a surgery. What we're going to be is an educational group. Doctor is Latin for teacher. And the purpose of the doctor is to help you understand your pain.
Well, Doctor, I appreciate that information. In fact, you've answered a couple of my own questions. I was going to ask you, what would make this medical office different? And you've explained that yourself, already saying that you would be more of a teacher than just a doctor coming in and taking my money.
We don't want you to come in and just expect to get a pill. We're going to prove to you that you're better when you're better. And the way we're going to do that is we're going to put you to work. We're going to give you exercise to do. And when you believe you're better, that's when you're done.
And that's what I would like to have when I go see a doctor, too. So you said again, where is your location?
32nd Street and Roosevelt Avenue. And the address is 3130 Roosevelt Avenue.
That's 3130 Roosevelt Avenue, just off of 36th Street, correct? 32nd Street.
32nd Street.
It's on 32nd Street and Roosevelt, 3130 Roosevelt Lane or Road? Avenue, Roosevelt Avenue. Okay, so we have the office location, and your guys' office sounds like a really different, good location, or a good office that I would want to go see a doctor to. How does this office fit in with Obama's new medical system? What kind of insurance and stuff will you be taking?
Well, we'll take all the money we can get. but I think our way of looking at the problem is different than Obama. And in that it's not insurance, it's enabling people to help themselves. The whole system of medicine now is just getting beyond all of us, because what's going on is it's getting bigger and bigger, and it's more out of touch with the doctors, it's more out of touch with the patients. And for example, if you were coming for physical therapy, which you can get at our office, the system will give you a certain number of visits that you're allowed. We don't want to do it that way. We want to prove to you you're better. So you're going to come as often as you want for a couple of months. You might pay $60 a month to come, but you can come as often as you want. And the reason you're going to stop coming is because you're going to know you're better. And the reason you're going to know you're better is because you've experienced it. It's not that you might have less pain, it's that you understand your pain, and you understand how you're going to deal with it. And that's where we're different, and that's why we're going to be a little different than Obama's care system.
So when you say that you are different, so what is the difference between physical medicine and rehabilitation, for instance?
Well, the problem is that what physical medicine and rehabilitation has become is acute care. That is, you come in, you get a certain number of visits, you get a certain number of treatments, and it's supposed to make you better instantaneously. But the problem is that we're changing. All of us are getting older, and we're all getting more frail, and we're all losing it to some extent. We're chronic care medicine, and the only way that's going to work is if you understand it better.
Okay. Just before you came in for your interview too, we've had some phone calls. Requested anybody to call into our phone line to request any questions from you. And at this time, we're going to be taking some phone calls with some questions. And do we have a first question?
I think that's us.
Yeah, that's us, yeah. So do patients come to you strictly by referrals, or?
Well, John Porter works at the county hospital, and there's a lot of patients that come through who have soft tissue pain, and they're really not candidates for any kind of in-hospital care. So he's going to be referring a lot of those types of patients. There's a lot of people I know who work in various jobs. I know a corrections officer, and those guys are constantly hurt, and he can come. And the idea is he's going to decide when he's better. And that's where we do.
You say you'll be taking certain insurance. That would be us having to contact you to make sure that our insurance is covered by your office, correct?
Yep.
And if we do not have insurance, what would be a local office visit that we would have to pay?
We're going to do it, as I said, by the month. So you're not going to get one office visit for whatever you pay. And it'll probably end up being $60 a month to come for at least 4 visits.
So it'd be $60 a month for 4 visits. Okay. And is there a website or a phone number that we can contact or look you up on?
That's that.
Okay.
We're
So just,
still working on it.
okay. But there is a phone number.
My cell phone will suffice.
Okay.
And-
So
and
if you're
that's-
opening up today, you're having a grand opening, does anybody show up physically at the 3130?
Hopefully.
Yeah. And what will your office hours be?
Well, right now it's not a lot. It's 10 to 2 on Wednesdays and Thursdays, and all day on Friday. That is about 10 to 5 on Friday, and that's it for my time there. Other people are putting in other times at that office.
Okay. And you say your office will be opening today for the first day of your grand opening. What will your hours be today? Same?
Normally, yes, but I'm not there today. So we didn't open. And actually, we opened yesterday.
Oh, so you opened up yesterday. Okay, they informed me that you were opening it up today, so I figured you'd come in and get the whole grand open going on.
Well, I thought so too, but we had a patient who needed to see us yesterday, so I saw him.
Okay, well, Dr. Gootzeit, thank you so much, and we hope that your business has a grand slam, and you get a lot of new patients in there looking for some new medical treatments, and you sound like you guys will be some really good doctors. Thank you very much.